Dr. Joe Congeni with us, Sports Medicine Center at Akron Children's Hospital. Good morning, Joe. What do you have for us today?
Hey, Ray. How are you?
Doing well.
Good. I was going to talk about a condition known as back spasms. There's a point guard in Cleveland. It leaves a lot of things up in the air. Have you ever had bad back spasms, Ray?
I have not.
Okay, good. I'm glad you haven't. And I've had mild to moderate, but never really severe. But so many patients do, and especially in adults. This is one thing. A lot of things that we see are the same in adults and similar in younger athletes. Younger athletes don't get spasms nearly as frequently, the junior high and high school kids, as adult athletes do for no reason. So they said, again, what I mean by no reason is they did an MRI. There's no structural damage, at least to what they say. There could be some wear and tear. There's 77 different muscles in the back, so there's so many different muscles, and they have to work together. We say in concert, work together, and if they're not working together, we have soft tissue injury in the muscles, some disc injury in the back. You know, there's also 33 vertebrae in the back. There's 5 lumbar vertebrae and 12 thoracic vertebrae bones in the back that can have some injury to them too. But what happens is in response to kind of an overload in sport or activity like jobs, a lot of people will just get where these muscles lock up into a spasm, and people cannot move well, cannot move predictably. They don't know when they'll catch or lock. And actually in the game Sunday, I think it was, they told us after the fact that George Hill really could barely move to get that behind-the-back pass from LeBron. It looked bad. It came at a bad time. He could barely bend over. And so he'd had such a good start, and then he was all of a sudden gone in the third and fourth quarter, and retrospectively we find out back spasms where he can't even play. So I wanted to kind of tell you with an athlete what we do when we see back spasms, and probably some of what George Hill has seen or done in the last week or two trying to get himself ready for this most important time of the year. When athletes go into back spasms, there's many different things we can do treatment-wise, and it's not always scientific that we try one at a time. We might throw everything at the athlete. You know, we call it the full-court press. We might start with, of course, some massage, and I'm quite certain that he got deep tissue or manipulation or mobilization for sure. There's a thing called muscle stimulation, which relaxes muscles. There's TENS treatments, which can reduce pain. There's injections into the muscle that can reduce pain, or into the spasm sometimes, different types of medicines that we inject to try to break that spasm. There's medicines athletes take by mouth. A couple of the newest things, and you and I have talked about these, dry needling and cupping, are both actually meant to induce a deeper injury in the muscle and the soft tissue, so then the body increases the blood flow to heal it, and there's great response to so many athletes getting dry needling now, and to a lesser extent this cupping that you've seen in the Olympics and other things. So all of these things I just mentioned could be and probably were a part of trying to get George Hill ready for Sunday and trying to get him ready for today. And these things can be a variety of medical people. The trainer does some of these things to try to get that spasm broken. The physical therapist in sports does some of these treatments. They will use physical medicine specialists, chiropractors, osteopathic doctors that deliver those different treatments. So it's not exactly pure science here, Ray, to try to break somebody who's in bad spasm as an athlete. But you can't have somebody going out on the court who's not moving predictably, because you can have outcomes, of course, that really hurt the team. So the coaching staff wants to know, the other players want to know, is it reliable that this spasm now is broken and that this athlete is going to be able to help us this week? And that's all of probably behind the scenes what they've been doing with George Hill.
All right. Great stuff. Good education. Joe, as always, thanks for the time.
Okay, Ray. We'll see you tonight, right?
You got it.
Okay. Take care.
Yeah, Dr. Joe Congeni. He'll be at the Student Athlete of the Year banquet with us at St. George's.